According to the American Podiatric Medical Association, 21% of women complain of heel pain. 12% of these women identify their shoes as the source of their discomfort. Each year, women purchase 200 million pairs of high heels and are twice as likely as men to visit a physician for foot pain.
A survey conducted by the American Orthopedic Foot and Ankle Society found that 50% of women confess experiencing pain from their high heels. 11% of these women indicate that their heels are 3 inches high. Could heels be contributing to the abundance of women's foot problems?
Physicians hypothesize that wearing high-heeled shoes has negative impacts on the knee joint. Prolonged and frequent wearing may even cause osteoarthritis of the knee. Osteoarthritis is a painful condition caused by the thinning of the meniscus. The meniscus is the knee's shock absorber. It pads the medial and lateral sides of the knee, separating the tibia and the femur.
Deflation of the meniscus causes the femur and tibia to thicken and grind together. Because 80% of the meniscus does not receive blood supply, it does not heal well after tear, trauma, or degeneration. This can lead to everyday pain and knee deformity. Due to decreased knee motion, the patient's leg may experience atrophy and increased amounts of pain.
The average height of women's high heels is 2.5 inches. At this height, the knee experiences additional external varus and knee flexor torque when compared to bare feet. Torque can contribute to the degradation of cartilage surrounding the knee joint.
For our final project, we want to test this torque. Is there a statistically significant difference between the torque experienced when walking barefoot or in heels? We think there is.
To test our hypothesis, we set up an experiment using the WeFit's infrared camera. 2 infrared LED lights were medically taped to the top and bottom of the patella. The subject was instructed to walk barefoot and in heels on pre-designated lines on a treadmill. The treadmill was set at a constant speed of 1.3 miles per hour. A small button was placed on the bottom of the foot and shoe to indicate impact. 3 subjects with size 8.5 feet were tested. They averaged 139 pounds and 66 inches tall. 10 data points were taken from the front and the side of each subject and analyzed using a student's t-test.
To analyze our results, we looked at 2 important measurements: the torque on the knee at impact when walking in bare feet and heels, and the angle at which that torque was applied to the knee. The amount of torque was determined by finding the length between the lateral and vertical position of 2 infrared LEDs using the Pythagorean theorem. The length was then multiplied by the force of impact, which was maximized at the weight of each subject. This gives us the torque of each knee. We found that in 2 of the 3 test runs, the torque calculated from the front of the knee in heels was statistically different from the torque on the knee when barefoot. The results are shown on the graph. The angle of torque was found by taking the arctangent of the vertical over the lateral difference in position of the 2 infrared LEDs. In 2 out of 3 trials, the angle of torque was also statistically significant between heels and bare feet.
It was hypothesized that wearing shoes with a 2.5-inch heel would increase the torque of the knee and the angle at which it bends to take a stride. Ashley, our data is totally right on with our hypothesis.
Yeah, but I bet with better testing material, we would have even more statistically significant data with our experimental design. But it was pretty hard testing on that treadmill.
It sure was.
And the Wiimote's infrared camera doesn't see long distances easily. Replicating the data perfectly to simulate 3 axes would have been easier with 2 separate cameras filming at the same time.
I agree, Ashley. Plus, there was only 3 people in the class who had the right shoe size and were available to be tested. But wait, Ashley, what does this mean about my shoe collection?
Well, Anna, let's just wait until more studies are done till we throw out those 2.5-inch heels.
High heel shoes, like red or blue. I don't mind what you do, just wear your high heel shoes. When we went out last evening, you look real fine. Oh yes you did. But there's something I've been keeping from you, and it's on my mind. Oh yeah. It doesn't matter which clothes you put on. The only reason that I've written this song is that when you put your high heel shoes on, you look like an angel. I can barely hold on. She's so bad, and I see her in her high heel shoes. I catch myself staring at her the whole night through. Will you wear your white dress and some of your high heel shoes? Oh, won't you wear that white dress? High heel shoes, black, red or blue. I don't mind what you do, just wear your high heel shoes. I get a funky feeling as you walk by. You got me so high, so high, so high in my mind. Yes, I do. Your hips move back and forth and to and fro. It's like they want everyone to know. I can tell you why. It would take me just one try. You got me so that I can see your heels are high. She's so bad, and I see her in her high heel shoes. She's so bad, staring at her the whole night through. Whole night through. You wear your white dress and some of your high heel shoes. In her high heel shoes. Oh yes, you look so beautiful. I don't know what I can say to you. One thing that really caught my eye is just the way